Thank you, Mr. Chairman. I just wanted to take a moment to thank you, Chairman Adderholt, Ranking Member DeLaura, and your staffs for all the hard work that's gone into the bill. Regretfully, I'll have to oppose the measure. The cuts that have been proposed in the bill will make health care less affordable, education and job training less accessible, and potentially jeopardize the futures of millions of Americans. Although the president said last month that he isn't thinking about Americans' finances even one bit amidst his negotiations to end the war in Iran, it is vital that members of Congress, particularly this Appropriations Committee, use this platform to ease the affordability burdens that are being faced by the American people. The bill's provisions that weaken the Affordable Care Act, that raise interest rates for student borrowers, that slash funds for vital teacher training and education initiatives for children in K through 12 elementary schools are not the way to go to address the challenges that Americans are currently facing. While I'm grateful for the inclusion in the manager's amendment of language that will enable Job Corps operators and campuses to accept shipbuilders' workforce development grants, equipment donations, and other investments, I'm still troubled by the 50% cut to the program. The Trump administration has targeted the program for closure. And while I'm grateful that the Appropriations Committee has rejected this drastic step, a 50% cut would result in closure of many of the Job Corps centers, layoffs of Job Corps staff, and place at risk the dreams and the aspirations of thousands of promising students. It's critically important that we fully invest in Job Corps. For over 60 years, it has paid tremendous dividends in terms of ensuring that young people become productive members of the labor force and not become reliant on public benefits. I remain hopeful that we can work together in a bipartisan matter in the coming weeks and months to restore funding for Job Corps so that it can continue to carry out its very vital mission. I also want to mention my strong opposition to the $1 billion cut that is proposed for the Centers for Disease Control and Prevention. I speak now not just as an advocate for our nation's public health, but also in my role as Dean of the Georgia Congressional Delegation. The CDC is one of the crown jewels of Georgia's economy. It employs thousands of people in Georgia with master's and doctoral degrees, and with students and researchers coming from across the world to study at Georgia research institutions heavily in partnership with the CDC, this organization contributes to a highly skilled workforce and a research ecosystem. The CDC stimulates immense economic activity, with every dollar spent generating $2 in economic growth for Georgia. Most of the CDC's budget, however, doesn't stay in Georgia. About 80% of its annual appropriation goes to state and local departments, health departments across the country, and these cuts will be felt. They will reduce disease surveillance, yield fewer immunizations, and fewer screenings for breast and cervical cancer for all of our constituents. It's heartbreaking to see the damage that the Trump administration and the Health and Human Services Secretary, Robert Kennedy Jr., have wreaked upon the CDC over the past 18 months. In fact, the New York Times ran a damning profile of Secretary Kennedy's dysfunctional leadership at the department this past Sunday. In the article, it described his little interest in managing the details of work in the department, his deep mistrust of career civil officials, and low morale throughout HHS, and his disinterest in matters that are not on his priority list. In other words, this is not the best and brightest that until this administration we've come to expect from the leaders over there. The firings and the high-profile resignations of top CDC leadership, the departure of experienced health professionals, the politicization of scientific guidance, the disparaging of career professionals, and now the $1 billion cut in the CDC budget do not bode well for our nation's ability to respond to emerging public health threats at home and abroad. President John F. Kennedy, the Secretary's uncle, once said that the time to repair the roof is when the sun is shining. Sadly, that is a lesson both he and House Appropriations Committee seem to have forgotten. We don't want to wait for another pandemic to begin to make investments in our public health infrastructure. We want to do it now when the conditions are favorable so that we are not caught unprepared. Millions of lives are literally at risk by the decisions that we make today. I do applaud the significant work that CDC is doing despite its leadership challenges to ensure that no infectious diseases are spread as the United States, Canada, and Mexico welcome guests from around the globe for the World Cup. The CDC has taken on a high-level role, gathering and reporting outbreak data, sharing guidance on testing and reporting symptoms. In recent weeks, CDC officials have convened weekly calls with public health officials in the 11 U.S. host cities and dispatched staff to assist them in person. Doctors nationwide are participating in simulations that anticipate the work. Secretary Kennedy, however, has left the department's response to Dr. Jay Bhattacharya, a health economist with no prior experience in public health, even though he's leading the CDC. I might add that he's also leading the National Institutes of Health as well. I'd also note that the Administration for Strategic Preparedness and Response, which is in charge of pandemic preparedness and standing up field hospitals and quarantine facilities in Kenya, is currently being run on an acting basis by John Knox, a former Los Angeles firefighter who founded a group, Firefighters for Freedom, during the pandemic to fight vaccine mandates. With Ebola raging in the Democratic Republic of the Congo, whose team is scheduled to play in Houston, Atlanta, and Guadalajara as well, as the recent case of hantavirus aboard the cruise ship, this is not the time to cut CD funding or for poor leadership. I hope that the Appropriations Committee will reconsider the unwise cuts to the CDC and to the other programs that will have an adverse impact on health care, education, and job training. And with that, I yield back.